No music. It's a bummer. No music.
Hey, everybody. Hey, welcome to another edition of Ansel Lee Live. Here, hey, we're starting our first in the series of for the fuel cohort that's going on this the next 10 weeks. And so, hey, welcome everybody. And hey, I've got to introduce my partner here to my left, Jeff Beecher. Jeff,
hello, everyone.
Good to have you here from wherever you are today.
The Space Coast.
Yeah, you saw some rocket being launched. I'm not sure about that. Hey, and I want to. We've got the CEO of Rainfall Health, Eddie Qureshi, on today, founder of Rainfall Health. Hey, welcome, Eddie.
Thanks so much for having me, Ansel and Jeff. Excited to be here.
Welcome, sir.
Yeah, and we'll find out in our discussion today. You've got to connect. You're from the Bay Area, and but you've got a connection to Batesville, Arkansas.
Absolutely, I still have family out in Batesville, and that's where my family's been for a couple of decades. We've moved around a bunch, but I feel like Batesville as home. That's where family is, and I'm excited both from the fuel perspective to be a little bit that much closer to home.
Oh, it's awesome. You also get home cooking when you're close to home.
Exactly. And Tom and Darian over at Fuel will get some gift packages from my mom, I'm sure, and not too long too, getting me that much closer from the Bay.
Well, hey, listen, we're excited to have you on today and for you to talk about Rainfall Health. Hey, tell us a little bit, what is Rainfall Health?
Yeah, absolutely. So Rainfall Health is a digital health platform for medical deserts, hence why Rainfall. We are an AI-enabled closed loop ecosystem for basically available providers. Where we really noticed, again, my mother's a practicing physician in Arkansas here in Batesville, and just experienced a lot of some of the inefficiencies in healthcare. And sometimes if it feels like from a patient perspective or provider perspective, you're that the mythical creature, the Sisyphus, when you're pushing the boulder up the hill and it keeps rolling back down. Because it is. Every time data doesn't move forward, folks, they should be focusing on actually getting you the care, the diagnosis, the healthcare delivery, get stuck in just trying to figure out where to get the healthcare started, how to get the information where they need it, and then how to hand it off to the next point in the journey.
Right.
And we joke here at Rainfall Health that right now, a lot of the policies and the way the system was set up was for these imaginary creatures we called healthineers that don't actually exist because it wasn't built for humans. And that's where we're coming in and making it more human-centric. That the fact that we can have this smarter technology laid on top for the patient experience and basically bring down, from a provider perspective, flexibly increase who you can refer that patient to in a flexible environment. What that results in is essentially 30% less no-shows. It results in connectivity within 24 hours, and we're already working. We've been live. We are in 5 states right now. We've been working with some amazing agencies and health centers, including the Indian Health Services. So we know what we're talking about, and our focus on medical deserts is, and especially that's why I'm so excited to be back in Bentonville, in Batesville, in Arkansas, because some of the states who have a larger rural population know what we're talking about. When people have to travel more, again, healthineers can do the traveling for the healthcare, but it's a little bit harder for a human. So we're surrounded by clinical care and services to make sure that everybody gets the care that they need in a timely fashion. That's Rainfall Health in a nutshell.
Oh, that's great, Eddie. It's good to see you again. I know we met a couple of weeks ago up in Bentonville at the kickoff. So welcome. It's really good to see you. So, Admittedly, I'm fascinated by what you're doing, and you're making it rain. So let's talk a little bit how you're doing that. I think we all can wrap our heads around rural hospitals and the struggles that they're facing. Can you kind of walk me through a real life example of, you're in 5 states. Just take me through how you are solving the problem for patients.
Absolutely. So when we landed in one of the populations we're working with is the Indian Health Services, like I mentioned. That we had folks that were waiting for care 10 and 10 and a half months at times for critical care. And handing patients off is actually quite challenging. You think about HIPAA, you think about compliance and security. You don't want to take that lightly. However, you're also kind of looking at it as an abyss from a provider perspective. You want to do best by your patient, but how do you actually hand somebody off where you're playing phone tag with, a limited pool of providers? So what we come in and do is actually take the patients off your hands with a simple button that says refer to Rainfall. And what that means is basically gives you as a health system, let's take a rural health center, as your selection across mental health, behavioral health, primary care, specialty care, chronic care. And you basically get to call in backup where you need it. Because if somebody's getting backed up in Low Rock, that doesn't necessarily mean they're also backed up in Bentonville. And in that flexible environment is kind of like the Uber model. And we find ourselves thinking about that a lot because essentially what they did that was so interesting was they never bought more cars to put on the road. And yet they got cars closer to people. They use the existing infrastructure more effectively. That's how we think of ourselves. Now, back to that case study, those folks that have been waiting 10 and 10 and a half months at times, we got those patients, hundreds of them, and within 15 hours, they had appointments. Within 24 hours, they had their medication at the Walgreens down the street. And later that next day, they had their follow-up appointment, which they can't get to until the first appointment happens. We're basically in the business of releasing that bottleneck and that pressure that gets backlogged and using the existing infrastructure much better for patients and also for providers. Because when you can maximize your time as a provider, that's a win. You get to help one more patient, one more person who really needs the care.
So Eddie, is it fair to say are you like directing traffic here? Are you sort of the hub, and there's a spoke system out there, and you're just filling the need, and you're having providers at sort of out in the perimeter? Is that kind of what? And are you using telehealth?
Yeah, absolutely. So we're the first company actually to do telehealth, digital health, and in-person care in the same spot. Now, telehealth, we've gotten all comfortable with it. We're all here virtually from 3 different parts of the country. We're doing something right. It's very exciting. Digital health is something that's even more, on your own terms, where, text-based care has become clinically validated. There's ways that you can do that for certain types of care and coordination. For chronic care, again, when you need, as a patient, to be engaging with their healthcare, several times a day, it's sometimes easier to have that sort of flexibility. And then in person, you just need to get hands-on for a patient from time to time because that's the only way to do it. So we coordinate all of that and have a dedicated support team as well to make sure that nobody falls through the cracks. So that we make sure that when we're directing traffic, people are getting from end to end where they need to go. And that AI layer on top helps make it smarter, easier, and more personalized. And that dedicated support makes sure that, again, we are making sure that there's that human element that we never lose in there, because that's so important. Because, I'm sure that's what we all would want on the other side of the table is that human touch when we need the care as well. So that's what we try to do and build. Along with the traffic navigation, we also do what we're thinking is like essentially building better highways between the systems. And that's where we really, all the magic that's happening on the back end, even though all you see in the front end is that beautiful, care coordination happening, this back end, we're building those highways that aren't the most exciting things to always talk about, but it's so powerful because you just get from one place to the next that much faster which again, so you don't get stuck pushing that boulder up the hill yet again.
So you're making it rain. Congratulations on this, getting to this point. It's going to be real interesting to see, talking to you 10 weeks from now when you're through the Fuel series. I know it's going to be a great journey for you. So congratulations.
Thank you so much. It's been fantastic so far.
Yeah.
Yeah. And which, hey, leads me to ask this question, that you applied for and you got into this fuel cohort. And again, congratulations. And what do you see? I know you've got, and let me also say congratulations that you actually have clients, and that you're out.
Thank you so much. We appreciate it.
That's the that's the hard part, and
making it rain.
Yeah, and so it seems like there was this guy that played the guitar that says "Let it rain." Anyway, we'll talk about that later. But what do you hope to get out of this fuel program and working with the guys there at Fuel?
Absolutely. They're such an amazing team. So we're excited for coverage across the piece, right? Like, we're an early stage company, and it's been great to have amazing mentors. On our team, we actually have the Ninth Secretary of the Department of Veterans Affairs, Dr. Shulkin, as part of one of our advisors. And we also have folks from that come from amazing experience, leadership at leading health systems, including Providence Health, one of the largest health systems in the country. And having this amazing group of mentors available to us here and back in my home state is really, really exciting, because that brings us again closer to why I started this company to begin with, right? We noticed that rural health centers specifically were having this critical issue around 1 in 3 still here in 2024 are at threat of shutting down. Medical deserts in this country are actually getting worse.
Right.
We need a fundamental restructuring on how we're approaching this. And the problem isn't actually with the rural health centers. It's again with that connectivity between the population, the 67 million people living in rural parts of the state, of the country, and the larger urban centers where the health system tends to be focused. So how do we maximize the existing infrastructure that's there in order to make that happen? So we're really excited about having these mentors accessible to us from an operations, the sales, and also being at the heart of this amazing institution. Again, with Walmart, for example, being there is really exciting for us, because there's all these health initiatives, and with an entity like Walmart having the real estate in rural areas closer than anybody else actually is pretty exciting. Again, it's the heart of innovation in rural care, which is where we like to be. And just the last piece, we're very, very lucky and humbled to always be chosen for this, because it's a great cohort that we're around, and we're excited to see where this leads.
Outstanding. Thank you. And hey, if folks want to find out more, where can we send them to find out more about Rainfall Health? Absolutely.
You can find us at rainfallhealth.com, or if you want to email us out at info@rainfallhealth.com. We're a partnership-based company. We have 50 partners across the clinical care spectrum. We're, again, 5 states. We're working with multiple health centers, and we're going after a fundamental reshift in how we're going to think about healthcare. And that's not an easy task, but it's a lot easier when we have partners that come in, and we're already excited about all the conversations we're having right there in Arkansas, especially, the state initiatives that are super exciting about how do you better serve the residents of Arkansas is something that's very exciting to us, because it really shows that initiative goes all the way from the top to the individual patients. And we're just excited to be that, Jeff, how did you put it? The traffic coordinators.
Yeah. Directing traffic. Yeah. Yeah. Well, make it rain, Eddie, make it rain. Yep.
Yeah. Yeah. Well, I would say even in this Arkansas, and even in this region, Oklahoma, Missouri, Tennessee, Mississippi, Louisiana, Texas, Kansas, that, even in this Mid-South region, that, there are a lot of rural health systems there that are really struggling. And we've got to give them tools to succeed, and really to care for their patients. So any help is a big help. So, hey, I wish you much success. Anything in closing you'd like to share?
I just like to say that it does take all of us to make an impact on such a massive scale, because you can't change healthcare just one at a time, because it's a system, it's policies. They're very thoughtful, right? Like, the reason why those things are there is, how can you have some of the smart, all these docs, all these amazing folks who've spent their lives dedicated to making healthcare better, and it hasn't moved as far as we'd hoped, right? It's more than that. We need, again, better technology, better infrastructure, because so many people are doing the right thing and just don't have the right tools. And so we're really excited to be in that business of elevating what people are already doing. But that means we need partnerships, we need health systems, we need payers, we need states, we need even the federal government and agencies. We're working with the Defense Health Agency, for example, and the Air Force and Army, and we're just excited to keep putting that stack of partnerships together, because that interplay there is what's really going to lead to the success for everybody.
Great. Congratulations, buddy.
Thank you so much.
Outstanding. And in closing, what I think your Batesville mascot, it really, you serves you well. The pioneer from Batesville, that you were being a pioneer. And hey,
I take that with a lot of grace. Thank you. I appreciate that.
Well, however we can help you. And hey, again, if you want to get a hold of Eddie, you can contact him here directly on LinkedIn, or if you have problems finding him, or just contact Jeff or me. Yep. And we'll connect you with Eddie. Eddie, thank you for being on here today, and wish you well. And hey, we'll be seeing you soon.
Sounds like a plan.
Thank you.
Thanks, Jeff. Thanks, Ansel. Really appreciate it.
You bet.